Right now, as we speak, American service members are in harm's way in the Middle East. Iran is launching ballistic missiles at U.S. bases across the region. And if that sounds familiar, it should, because we've seen this before. I'm Dr. Sharma, physician, board-certified psychiatrist, and Air Force veteran. Today, I want to talk about something that does not bleed. It doesn't leave a visible scar. And for years, it was dismissed as just a headache. I'm talking about traumatic brain injury, or TBI, the invisible wound that has quietly been destroying the lives of hundreds of thousands of veterans. And with active combat operations happening right now against Iran, this conversation has never been more relevant. Let me take you back to January 8th, 2020. That night, the regime that governs Iran launched a massive ballistic missile barrage at Al-Assad Air Base in Iraq. We're talking about at least 11 theater ballistic missiles slamming into that base, each one carrying warheads estimated between 1,100 and 1,700 pounds of explosives. This was the largest ballistic missile attack ever against American forces. Initially, we were told no Americans were hurt, no casualties, but within days that number went from 0 to 11, then to 34, then 64, and eventually over 110 service members were diagnosed with TBI from that single attack, over 110. One of those service members was Lieutenant Colonel Allan Johnson. He's a retired Army officer now who served over 27 years. He was there that night, and he was sheltering in a bunker that was designed to protect against rockets and mortars, not massive ballistic missiles. He testified before Congress relatively recently, March 5th, 2026, that he was knocked unconscious twice during the attack. One of those missiles impacted just 60 feet away from his position. Johnson now lives with TBI, PTSD, cranial nerve damage, double vision, broken teeth, chronic insomnia, tinnitus, neck pain, balance problems, difficulty finding words, and more. He says that he feels emotionally distant from his wife and children. He worries about whether he will ever be the husband, father, and friend that he was before that night. And he's not alone, not by a long shot. Since the year 2000, over 500,000 service members have been diagnosed with a TBI. Let me say that again, over 500,000. And the vast majority of those are classified as mild TBI, which is also known as concussion. But don't let the word mild fool you. There is nothing mild about what these injuries do to people's lives over time. Here's what happens inside the brain during a blast. When an explosion goes off, it creates a pressure wave, a wall of compressed air that moves faster than the speed of sound. That wave passes through the skull and hits the brain. It doesn't need to crack your skull. It doesn't need to leave a mark. But it disrupts the brain at a cellular level. It causes shearing of nerve fibers, inflammation, disruption of the blood-brain barrier, and metabolic changes that can persist for months or even years. Research on veterans exposed to blast waves has found damage to areas like the cerebellum, which controls coordination and balance, and patterns of abnormal brain activity that are distinct from PTSD alone. And here's the thing that makes blast TBI particularly dangerous. It's invisible. You can't see it on a standard CT scan. Many times you can't even see it on a routine MRI. The standard military screening tool for concussion, it's called the MACE-2, was shown to miss a significant number of TBIs after the Al-Assad attack. Johnson himself, who was an aeromedical physician assistant evaluating soldiers after the blast, has said that many of the troops he screened didn't show symptoms for weeks. The symptoms are often delayed, they're subtle, and in a combat environment where everyone is trying to stay on mission, they're easy to dismiss. You guys know this. Just try to push through. You don't want to put pressure on the people around you. Soldiers were going right back to duty within hours, some of them helping clean up debris at the blast site, a site that was later found to contain radioactive isotopes, heavy metals, and toxic chemicals. Now, this is where my AUM model comes in, and I think it's critical for understanding TBI. A stands for awareness. The first step is recognizing that TBI is real, it's physical, and it's not just a headache. For too long, these injuries were minimized. You heard it at the highest levels, leaders calling these injuries not very serious or saying troops just had headaches. That kind of language does real damage because it discourages service members from reporting symptoms and seeking care. Awareness means understanding that when a blast wave hits your brain, something physical changes. It means knowing that symptoms like memory problems, irritability, trouble sleeping, dizziness, sensitivity to light, mood swings, difficulty concentrating, they're not signs of weakness. They're actually signs of injury. Awareness also means recognizing the downstream effects. TBI doesn't just affect the brain in isolation, it cascades through the entire body. Veterans with TBI have higher rates of PTSD, depression, anxiety, and substance use disorders. Research has shown that veterans with a history of TBI are roughly 1.5 to 2 times more likely to die by suicide compared to veterans without TBI. One study found that the suicide rate for post-9/11 veterans with TBI peaked at 100 deaths per 100,000, 5 times the general population rate. TBI is also linked to increased risk of cardiovascular disease, diabetes, dementia, and other conditions. Johnson himself is now in a thyroid surveillance program because of new nodules that developed after his exposure. And of course, there were exposures to chemicals as well, which might be part of that cause. And tragically, one of the soldiers Johnson helped treat after the Al-Assad attack, specialist Jason Quituga, hopefully I'm pronouncing that right, was diagnosed with TBI that caused headaches, insomnia, PTSD, and severe depression. He died by suicide on October 7, 2021. That's not a statistic, that's a person. In the AUM model, U stands for understanding. Once we're aware that TBI is happening, we need to understand why it's so devastating and why it's been so hard to catch. The blast wave from an explosion creates what researchers call primary blast injury. It's different from getting hit in the head by shrapnel or being thrown by the force of explosion. It's the pressure wave itself passing through brain tissue. And with the kind of massive theater ballistic missiles Iran used and is using now, we're talking about professionally manufactured weapons with enormous payloads. The blast effects are orders of magnitude greater than what you'd expect from a typical IED. Understanding also means grasping why so many TBIs go undiagnosed. In a combat environment, service members are trained to push through. They don't want to leave their team. They don't want to be seen as weak. And the screening tools we've been using aren't catching those injuries in the field. Johnson's own research found that more than 80% of the military personnel at Al-Assad reported blast exposure, and nearly half still had persistent symptoms 4 to 6 weeks later. A follow-up study found that 34 of 35 patients within 100 meters of a blast impact met criteria for mild TBI, but many of those weren't caught by initial screenings. Understanding means knowing that TBI is cumulative. Multiple brain injuries compound the risk. Veterans with repeated TBIs are about twice as likely to experience suicidal thoughts compared to those with no history of brain injury. And the effects of TBI can emerge or worsen years after the initial injury, which is why long-term monitoring is so critical and why this needs to be understood in the veterans' benefits process as well when it comes to disability ratings for TBI. Now, here's where this gets extremely relevant to what's happening right now. We're obviously currently in active combat operations with Iran, at least at the time I'm recording this video. U.S. service members are being exposed to missile and drone attacks across the Middle East as we speak. Iran has been launching ballistic missiles at U.S. bases in multiple countries. Service members have already been killed and wounded in this current conflict. And if we learned anything from 2020, it's that the true scope of blast-related brain injuries won't become apparent for weeks or even months or even years. We can't repeat the same mistakes again. We cannot downplay these injuries again. M in the AUM model stands for mastery. This is about taking what we know and actually doing something about it. And mastery has to happen at 2 levels, the system level and the individual level. At the system level, Lieutenant Colonel Johnson laid out specific recommendations to Congress. He's calling for improved field screening tools that can actually detect subtle and delayed brain injuries. He's calling for brain MRIs after blast exposure, not just the standard screening checklist. He's calling for baseline and follow-up neuropsychological testing so we have something to compare against. He's pushing for thyroid screening, expanded cancer screening for blast-exposed personnel, and the increased federal investment in research that focuses on actually restoring brain function, not just managing symptoms. These are common sense measures, and the fact that we're still fighting for them in 2026 is unacceptable. We also have to talk about the culture within the military. That needs to change as well when it comes to seeking help for brain injuries and mental illness in general. That also needs to change from the leadership all the way down. At the individual level, and this is for any veteran watching this video who has been exposed to blasts, whether it was IEDs in Iraq or Afghanistan or training exercises or these current operations. This also includes firing repeated artillery rounds. Remember, that is also blast exposure. Mastery means advocating for yourself. If you were near an explosion and you're experiencing any of these symptoms, headaches, memory issues, trouble sleeping, irritability, dizziness, mood changes, difficulty concentrating, all the other TBI symptoms, you need to get evaluated. Don't let anyone tell you it's just a headache and brush it off. Don't let anyone tell you you're fine because a screening came back negative one time. Push for a comprehensive evaluation. Request neuropsychological testing. Get a referral to a TBI specialist. For those of you supporting veterans, so family members, friends, colleagues, mastery means understanding that someone with a TBI may not look injured. They may seem fine on the outside, but inside they may be struggling with things they can't fully explain or even understand themselves. So be patient, be present, encourage them to seek care. And veterans with brain injury, remember your triggers. If you know that certain environments, situations, or stressors are making your TBI symptoms worse, so bright lights, loud noises, crowded places, high-stress situations, take steps to manage your exposure. That is not weakness, that is smart. Talk to your healthcare provider about what accommodations might help. Look into cognitive rehabilitation therapy. Explore options like occupational therapy, speech therapy for word-finding difficulties, vestibular therapy for balance problems. There are treatments available, but you do have to advocate to get them. The bottom line is this: traumatic brain injury is the signature wound of wars in Iraq and Afghanistan, and with what's happening right now in Iran. We are about to see a new wave of these injuries, potentially even at a higher level or severity. Over 500,000 service members have already been diagnosed since 2000, and that number only counts the ones we've actually caught. The real number is almost certainly higher. We owe it to every service member, past, present, and future, to take this seriously. We need better screening, better treatment, and better long-term care. We need to stop minimizing these injuries and start treating them with the urgency they deserve. So the next time someone minimizes TBI, remember Lieutenant Colonel Johnson getting knocked unconscious twice by Iranian ballistic missiles 60 feet from his position. Remember Specialist Quitugwa. Remember the over 110 service members from that single night who were initially told nothing happened to them. Symptoms are not excuses, they're injuries, and they deserve to be treated as such. Drop a comment and let me know your thoughts. Have you or someone you know dealt with TBI? What has your experience been with getting screened and getting care? Are you concerned about what's happening right now with the Iran conflict and what it means for a new generation of blast-exposed service members? If you enjoyed this video, you might like the episode I did on why you still feel on edge after military service. Click over here to check it out. And if you want more content like this on veterans' health, mental health, and benefits, click over here to subscribe if you haven't already done so. While you're at it, throw a like on this video. I want to thank you for taking time out of your day and joining me for this episode. As always, thanks for watching. Dr. Sharma signing off. See you next time.